Ladies and gentlemen, it's my great honor to be here to introduce the nuclear medicine in China. I'm Dr. Jing Wing. I'm working in the Department of Nuclear Medicine of Xijing Hospital in Xi'an of China. Along this timeline, Chinese nuclear medicine can be traced back to the 50s of last century. In 1956, Professor Wang Shizhen initiated the Chinese nuclear medicine. The Chinese Society of Nuclear Medicine, CSNM, was founded in 1980, and the Journal of Chinese Nuclear Medicine was first printed on next year. The first imported SPECT was installed in 1983. Since then, the nuclear medicine in China developed rapidly. Here now, the CSNM has gone through the 11 sessions. There are the pictures of 12 presidents. I'm the last one, CSNM president right now. All the former presidents have made great contribution to the development of Chinese nuclear medicine. The regular term of service is 3 years now. The committee of the CSNM included 63 members, a president, a former president, and the president-elect, 4 vice presidents, as well as 21 standing members. Under the management of the committee, Young's Committee and 11 groups were set up, including cardiology, oncology, neurology, radiopharmacology, and so on. The Committee of CSNM has its own website to introduce the development of nuclear medicine and the update news. Welcome to visit our website to know more about us. In order to have a great contribution to the diagnosis and the treatment of related diseases, CSNM, together with other Society of Chinese Medical Association, have formulated nearly 30 criteria, guidelines, and expert consensus. In 2020, the CSNM conducted a national survey of nuclear medicine, covering 31 provinces of China. This is the number of nuclear medicine departments in China in the past 30 years. As of 2019, there are currently 1,148 nuclear medicine departments nationwide. There are currently 427 positron devices, including PET-CT and PET-MR, and 903 single-photon devices, including SPECT and SPECT-CT, across the country. While in 1989, 30 years ago, the number of positron equipment and single-photon equipment was 0 and 44 units, respectively. Chinese nuclear medicine has made great progress in the past 30 years. This is the distribution of positron equipment in the country. It can be seen that the provinces and cities in the southeast coast have the largest. This is related to the level of local economic development, and the level of economic development in these areas is also the highest. Among them, there are 44 units in Guangdong provinces, 35 units in Beijing and Shanghai, respectively. In 2019, there were 120 medical cyclotrons nationwide. They were deployed in 117 medical units. In 2019, there are a total of 41 small animal PET, SPECT, MR, CT, and other equipment in the country. This is a workload of nuclear medicine investigation across the country. In 2019, approximately 2.55 million people underwent SPECT examinations, and 860,000 people underwent PET and PET-MR examinations, both of which are significantly higher than in 2017. The patients undergoing PET-CT examinations were mainly tumor patients, accounting for 97%. The rest were neurologic, cardiovascular, and bone imaging. Similar to PET-CT, patients undergoing PET-MR examinations are mainly tumor patients, accounting for 87.4%, but there are also a certain proportion of patients with neurological and cardiovascular diseases. This is the SPECT imaging situation, mainly bone imaging, accounting for 63%. The endocrine system and the urine system accounting for 16% and 12%, respectively, while the cardiovascular system accounting for only 4%. There are 770 nuclear medicine departments nationwide that carry out radionuclide therapy, and there are 2,544 radionuclide therapy beds, mainly for the treatment of thyroid diseases and bone metastasis. In 2019, 145,000 hypothyroidism patients and 84,000 thyroid cancer patients received iodine-131 treatment. 89 strong tear treated 10,000 bone metastasis. According to the data up to 2019, there were about 12,500 people engaged in nuclear medicine-related work in the country, including 5,400 doctors, 3,700 technicians, 2,600 nurses, and 210 radiochemists. China has started to develop its own nuclear medicine equipment in early 1960. Scanner and gamma camera were made in 1970s, and the first domestic PET was produced in 1990s. In the past 10 years, Chinese nuclear medicine equipment manufacturing has developed rapidly. About 6 manufacturers could produce PET-CT devices. The first domestic SPECT with double detectors has been approved by National Medical Products Administration (NMPA) in 2017. The PET-MR is already merchandised. This slide shows the status of radiopharmaceuticals in China. 12 radiopharmaceuticals for PET imaging, 15 for SPECT imaging, and 12 for radionuclide therapy have been approved by NMPA and used in routine clinics. Currently, there are 34 radiopharmaceuticals approved by CDE for clinical trials, including 7 for SPECT, 12 for PET, and 11 for radionuclide therapy. According to the type of diseases, 44% of radiopharmaceuticals is for tumor diagnosis, 41% for radionuclide therapy, and 15% for CNS diagnosis. 40 GMP-qualified centers were established to produce radiopharmaceuticals. Our National Radiopharmaceuticals Delivery Network, which covers 20 provinces, has been set up to supply the radiopharmaceuticals for clinical service. In order to promote the development of nuclear medicine, national and local academic activities have been held annually. Each year, CSNM organized 7 national conferences. This slide shows the national conferences of nuclear medicine from 2017 to 2023 that were held in different cities in China. Over 2,000 delegates attend these conferences every year. We warmly welcome all of you to join us in the future. CSNM also pays special attention on the international academic exchange. As early as the 1970s, Professor Wagner came to China to teach in cardionuclear stethoscope technology. In the past, many Chinese nuclear medicine colleagues have participated in international academic conferences, including SNMMI, EANM, and so on. As a highlight country, in 2018 SNMMI, about 200 delegates attend this meeting. During 2023 EANM, we visited IAEA and had a talk with the Deputy Director General Najata. In 2021, an official document was jointly issued by 8 ministries. The document defines the targets and guidelines for nuclear medicine in the future, including research and development of radionuclide devices and radiopharmaceuticals, as well as the training of human resources. A target has been set to establish 1 nuclear medicine department in every country of China and in every tertiary hospital by 2035. Next year, the annual National Conference of Chinese Society of Nuclear Medicine will be held in Zhengzhou, Henan Province, in September 19 to 22. Welcome to China. Thank you for your listening. Have a nice day. Thanks.